Good afternoon. Thank you very much for being here. I really appreciate the audience for sticking around for us. It's a very relevant and important topic for the panel. And what I'd like to do is introduce the panelists in no particular order. The first one is Leela Kunhiraman. She is the health educator with South Asian Heart Center. And then we have Geeta Kulkarni, Vice President of Development at the Akshaya Patra Foundation. And let me pull up my other ones. And sitting next to me is Himanshu Seth. He is the co-founder and treasurer, Saloni Heart Foundation. And next to him is Mari-Lyn Harris, Chief Kindness Officer, Heart at Work LLC. And last but definitely and certainly not the least is Tasha Keirns. She is the Director of Nursing, RealOptions, Obria Medical Clinics. All right, thank you for being here and being so patient. You all are more qualified than I am, so I'll let the talking begin. But before we get into the discussion, I think I would like to start with Geeta. If you can have 2 minutes of introduction of what you do, the organization, the objectives, and your little bit of experience, so then we can delve into the discussion.
My name is Geeta Kulkarni. I represent Akshaya Patra Foundation. It is the world's largest non-profit organization that serves midday meals. We serve 2 million children every day in government schools in India. We cover 14 states and 2 union territories and around 20,000 schools. So you must be talking about what is this, and the government also has the program of midday meals and why Akshaya Patra is doing this. So this is a strategic intervention to encourage children to come to school. In India, there's a lot of poverty and parents do not encourage children to come to school. So this is the way we motivate and attract children by providing them free, hygienically cooked, nutritious meal each day. And Akshaya Patra, Akshaya means it's unlimited, inexhaustible. It is a Sanskrit word. And Patra means a vessel. So the organization encourages children to come for unlimited servings. And this, the impact of this, what we have seen is the increase in enrollment, attendance, and moreover, the attendance of the girl child in the school. And also, we are enhancing their educational performance by encouraging them to come to school.
So again, my name is Tasha Keirns. I'm a registered nurse, the Director of Nursing at RealOptions, Obria Medical Clinics. So we are a nonprofit organization. We have 3 divisions to our organization. The first is we focus on prevention in health. So we provide education in public and private schools, as well as interact with the community at different events. We also provide intervention medically in our 5 licensed medical clinics around the Bay Area. We serve in each the Alameda and the Santa Clara and San Mateo counties in our 5 medical clinics. The services that we provide in our clinics are specifically to underserved, vulnerable populations that may or may not have insurance. We do not discriminate against political status, immigration status, race, religion, even ability to pay. Everyone who needs the services that we specialize in are able to come into our clinics regardless. So we offer care to women and men. Women first, we specialize in pregnancy testing, verification, and ultrasounds. We also provide women who are interested in carrying their pregnancies prenatal services, which in our communities, low socioeconomic status, patients, that's a very huge need in the areas that we're serving, is to be able to have early access to prenatal care. We also provide annual well woman physical exams as well as GYN problem visits. We also serve the men in our community and women through STD testing and treatment. And then we also provide abortion pill reversal for those who are in need. Lastly, our restoration area of our organization, we provide pregnancy loss healing programs through support groups that we hold every other week. In addition to that, we hold retreats quarterly for those that need services in recovering from pregnancy loss, whether that be from miscarriage, ectopics, or abortions.
Hi, Leela.
Hi, my name is Leela, and I work as a health educator with the South Asian Heart Center. We are a nonprofit organization, and our mission is to reduce the risk for developing heart disease and diabetes in the South Asian community. Most of our participants, we don't call them patients, they are participants, they enroll in a program. Um, uh, the incidences to kind of how do we prevent these diseases, because as all of you know that the South Asians carry the largest burden of heart disease and diabetes, and of in recent times we know diabetes is reversible, right? So if it's pre-diabetes, it can be reversed. And for programs like the Stop D, which is one of our specialized programs, we take everybody, whether you are South Asian or non-South Asians, everybody can join in the program. The programs which we run are lifestyle-based interventions. So we come somewhere between the physicians and the participants, let's say. So we are the kind of a lifestyle pharmacy, you can call us, that we take that time and invest with people in breaking down habits and in helping them to build new habits which can prevent both these diseases.
Marianne.
Hello, I'm Mari-Lyn Harris. I call myself Chief Kindness Officer because somebody said I could. So actually, I do promote kindness. I started my business 20 years ago promoting kindness in business. And since then, I'm kind of now doing as a doula giver, and that just means I walk people home. And in between all of that, I noticed that in the healthcare end of things, when patients or clients, whatever you want to call them, who are at the end of their life, you find a lot of issues that happen in for-profit companies versus nonprofit companies. So I firmly believe nonprofits are more beneficial for our health system because they're there to serve, and the for-profits are more interested in the bottom line. So there's a big issue about that as well, and as the end of life happens. So I'll talk further about that if there's any other questions.
Thank you, Mari-Lyn. I'm Himanshu Seth from Saloni Heart Foundation. Saloni Heart Foundation's mission is that every child born with congenital heart disease, which I'll explain in a very simple sentence, a child born with a hole in the heart. That's the simplest way to show what CHD is. And there are more complex CHDs, which we'll talk further. But our mission is to ensure that every child born with CHD should have access to the world-class pediatric cardiologists and pediatric cardiothoracic surgeons. And we started this nonprofit about 3 years ago in memory of our own younger daughter, who was born with congenital heart disease, and unfortunately we lost her in 2018. Since then, we have helped many families of children born with CHD by providing them second opinion from some of the world's best pediatric cardiologists and pediatric cardiac surgeons. We also run a scholarship program for the students who want to become doctors. So we sponsor their 5 years of medical school education and boarding. And as a next step, which I'll explain further, we are in pursuit of building a center of excellence in pediatric cardiac healthcare, which will not only treat thousands of children born with CHD, but also produce world-class pediatric cardiologists, pediatric cardiac surgeons, nursing staff, and a whole range of other doctors and medical professionals who are focused primarily on pediatric cardiology. Thank you.
Thank you very much for those introductions. Want to take a 30,000 feet level. All these services that you have mentioned are all close to your hearts. Essentially, there's a very different debate for another day, but all these services, or most of it, needs to be taken care by the governments of the day. If you go to Canada or to the United Kingdom, parts of Europe, Scandinavian countries, they have pretty decent, universal health care. I don't think this is time to debate that. But in the absence of that, that's where the nonprofits come into play. There are always a lot of daunting challenges, but there's nothing can be done to 100% satisfaction of all the players in the ecosystem. So the question is, related to our topic today, is where is the need becoming more critical for us to get into helping and taking care of the ecosystems that we serve in the communities that we are addressing the needs to? And why do you think that happens? And it's by any particular order. The roles are very important for nonprofits. But first, why do you think this need arises? And two, how do we enhance and try to fill the gap between what is available and what is missing? It's exactly what you're trying to do. Himanshu, you want to take up, or?
I will talk on behalf of India government. Because we have this program in Indian schools. So government has a very good program of midday meal. And why are they providing this midday meal is just for the cognitive development of the child. And the cognitive development of a child takes place at a certain age. So from 1 year to 5 years, if you're talking about, then that nutrition is also very important. And in the schooling years, from 6 years to 18 years, that is also very important. Government has very nice program in place. They have very good processes in place, but only thing is implementing those becomes a challenge because of the scale of the program and also the need of the program. So they partner with the non-profit, and that's when the government has partnered with Akshaya Patra to implement these programs in a better way in the schools. So we are partnering with the government to provide midday meals, and we are able to provide them proper nutrition, whatever the government suggests and the government norms are. So we have to follow the calorific value or the carbs and the protein content, what the child has to get at each age group. And they have an Anganwadi program that is we call as preschool program, where we are feeding the children from 1 year to 5 years school. And then this is also the what we were talking about, the prenatal and the nursing moms. So this is the Anganwadi program contains that program as well, so that the child, before it is born, it has to get proper nutrition. And they have given us access to the women who are pregnant and are nursing mothers. They can come to the schools and we can provide them with proper nutrition. So government has all these programs, but it is to implement the programs, they take help from us.
Tasha, the resources are available, and you agree with Geeta that the implementation or access to the resources already provided is a challenge, and that's where you come in and kind of educate and also mitigate the challenge?
Yeah, absolutely. So in public health, it's absolutely critical that women and men and families have access to what nonprofits provide to fill in that gap that we see with these health disparities in our communities that are lacking resources. And so, for example, women that come into the RealOptions clinics have the opportunity to provide receive a pregnancy test, have an ultrasound provided, get confirmation of their pregnancy, and then continue on with whatever decision is best for them. So that way they have the opportunity to access early resources for prenatal care and have a wide array of practical support services for them. These are critical needs that the community has that they would not be able to receive elsewhere if they were uninsured, if they were low income, if they've just moved here recently from another country and their immigration status is not yet quite complete. These are critical areas of health, not only for the women, but the fetus that she's carrying, as well as her children at home and the future generations after them. Providing these resources and allowing women and their families to access equal access to healthcare is going to have immense implications in the future, not just for that individual family, but for the society at large.
Leela, any thoughts?
Yeah, it's a great question, and I think there's so many answers to it, or so many facets to it, right? And I can only speak about how at the South Asian Heart Center, it's very unique in the sense because we are just targeting two diseases, diabetes and heart disease, right? And most of us, we don't think about these diseases till it actually hits us or hits one of our family members or, somebody at home. Till then we think, oh, all is well, I'm eating well, I'm exercising. So where we fit in is that where we want to kind of everybody to be aware is that you can start small and start early so that it's not at, only when it hits us that we kind of, get up and, okay, I need to make all these drastic changes, And we are very good, now in these days and time, we are very good at doing it, right? If you ask somebody, lose 5 pounds. Yes, I can do it. I can do it for 3 months. I can do it for 6 months. What about life? Your whole life, can you sustain it? And where we are working with participants is look at sustainable habits, that you still want to enjoy your life, you do the things you want to do, and you make those changes, your next generation, your kids, you're raising kids, they learn from you, and they can implement. So I think as a nonprofit for physicians or the health team, they just don't have the time. The population is too big. There's a health staff crunch. And they can verbally tell you, yes, you need to do this, but you need somebody else, like in a nonprofit, where it's driven by volunteers from the community who come out and help. And our programs, we have health coaches who are part of the community. So they get trained in the program, and they help people, connect with them on a monthly basis, talk to them at their level, at, wherever they are, and make those baby step approaches. So that's what, I think where as a health, where can we fit in as a non-profit, right? Because all these programs have to be subsidized. And when you look at non-profits, I think the two biggest trends are the volunteers who put in the time and effort, and of course funding. So, and we have to reach out to the community to make them more aware about these problems.
Thank you. Mari-Lyn?
I would just say, as far as the nonprofit entities, it's just, I'm not a nonprofit, but I will say that working with people who are in my field, my clients that I work with, I've just noticed that there is a lot of challenges. When people get aged, they either get put into a home or they decide they want to be at home when they get the terminal illness. But what we've been certainly seeing is on a perspective of a for-profit home care or terminal illness place or anything, if it's run by a company that's only interested in investing to make money, you're going to find that the care isn't going to be as good than if you are placed in a place that is a nonprofit. because I believe that nonprofits are there to serve the people, and whatever it is, that they have to meet them where they're at. And I've just seen it. Just watch the news. You pay attention to the news and see what's going on. So the latest thing is for, as an example, for a for-profit company owning a long-term care facility, is that what they're doing now? If the patient runs out of money, they don't want to care for them anymore. So they call what is called now as dumping. They dump you out the door and they leave you there because they don't want to work with you anymore because you have no more money. So that needs to change. And I am sure that there's more nonprofit organizations available for people to go to, or they just really end up coming home to the family. So like most of the people, my role as a doula giver is really motivated by the boomers who are passing now, and they do not want to die in a hospital by themselves. They'd rather be at home with their family, their loved ones. So that also creates another dynamic, is how can these families support the people that are in the end of life? So there are lots of other organizations, and it's creating a new opportunity to be of service and a great opportunity to get involved with this. So I do encourage other nonprofits to step up and say, hey, how can we help solve this problem, this issue? Because there are people that don't have families. So anyway, that's...
Thank you.
I'll restrict my views on the pediatric cardiology side because that's where I know the numbers. So not many people are aware that 1 out of every 100 children are born with congenital heart disease, irrespective of the country, irrespective of the geography, irrespective of the social strata. 1 out of 100. That translates to 40,000 children born every year in US alone. Now compare that to India, where I come from. 250,000 children are born with congenital heart disease every year. For 40,000 children in US, there are 115 pediatric cardiac centers. Okay? 40,000, 115. For 250,000 children in India, there are just 10 pediatric cardiac centers. Digest this fact. Now, each of the pediatric cardiac centers have a capacity to do 500 to 1,500 surgeries a year. That's it. So for 250,000 children, only 10 to 15,000 surgeries happen a year. And these are just 2 country figures. Now imagine the complexity of this. A child, when is born, its heart is the size of a walnut. Doing an open heart surgery on a child whose heart is just a walnut size, or on an aorta, which is the main artery, inside that artery, which is a vermicelli thick artery, is not science, it's art. And that level of expertise is only available in very few hospitals, that too in US. Now, let's talk about the government's role. Government has so many things to manage. The biggest thing that a government can do here is universal healthcare insurance. Because each of the surgery in US costs $1 million upwards. So you may have heard of these names like Jimmy Kimmel. His son was born with congenital heart disease, underwent a surgery on the 6th day of his birth. He's 6 years old now. Sylvester Stallone's daughter, Shaun White, who's a 5-time Olympian, he was born with a CHD. Arnold Schwarzenegger, Mr. Universe for like 5-7 years. They were all born with congenital heart disease. What we are trying to do is bridge the gap between the expertise that is available only in US to elsewhere in the world, so that we can produce more such pediatric cardiac surgeons, nurses, cardiologists, and that's where the nonprofit role becomes more important, because we can connect with so many more specialists than the government alone. And the government support is coming. I mean, we are talking to the health minister of India, we are talking to the Surgeon General of India, and they are open to giving us space to build a center of excellence within a medical university, which is par excellence, run these courses to train the next generation of pediatric cardiac medical staff, and also support with universal healthcare insurance.
Thank you. Thank you. Very pertinent point. Appreciate that. Scaling is a major issue because you have to reach out to the communities. Two very important stakeholders: the volunteers or the human resource to run the organizations, the donors and the financial independence to meet those causes. Geeta, your organization does fabulously well in reaching out to 2 million kids. Everybody knows the stories of how scientific your kitchens are in the heartland of India in small towns. It's been a good study for Harvard and Yale students, etc. So scaling has been done really well. You've also mastered the art of collecting funds, but not everybody's as privileged. So we have two extreme on the spectrum. One is Himanshu on one side is personally getting involved to pull this, and you have a lot of resources. In between, we have everybody else. So wanted to learn how do we address that particular challenge. A lot of people amongst us have this innate desire to go out and help. If they don't want to join, they always want to start. I think it's a human desire to let me do something big for somebody else. But that thought itself is not enough to translate to what you want to achieve on the ground. A lot of challenges. But let's focus on those two: building a good team and raising money.
Yeah. So everyone has this perspective of running a non-profit with volunteers. But in Akshaya Patra, we have 7,300 employees working in our 65 kitchens. So why we have adopted that strategy is, it's giving employment to local people. It's very important to employ locally. Second is, the earlier panel was about women empowerment. And in Akshaya Patra, we ensure that out of that 7,300 right now, we have 30% of women employed. And why we have employed women is, they might not be literate, they have not studied, they have not gone to colleges and schools, but they are good at their work and they are good in cooking. So they know how to run the kitchens, and they know, because they are mothers, they know how important it is to provide nutritious meal to the child who is coming to the school. And the employees who are in our kitchen, their children go, they are the beneficiaries who go to the school. So we try to empower women as much as possible. Second is, when we are providing this meal in the school, we have seen that the parents are encouraging children to go to school, mainly the girl child. So I will just tell one story. Like, I was in Vrindavan, which is in the north part of India. I used to go and visit the parents and encourage them to send the girl child to school. So they used to say, what is the need of educating a girl child? Anyway, she has to manage the house and she has to cook and serve the family. And so my counter question was, what do you do for a living? What do you do right now? So they used to tell me that, oh, I go and work as a maid in 10 different houses, 15 different houses. So my next question was, what do you want your child to do? What do you want your girl child to do? And she said, oh, I will marry them into a rich family. So I was always telling them, once you educate the girl herself will be able to decide whether she wants to marry that person or not, and she will be making you rich. So that encouraged them to, oh, is it? If she gets education, will she become rich? And I said, like, that will be the only single most powerful factor that can, help you to come out of cycle of poverty. And that's when now, initially, when we started in the year 2000 by feeding 1,500 students, there were only 10% of girls and 90% of boys in the school. Now it is 50-50% ratio. So there also we have improved. On your second point of how do we raise funds, so we would encourage all of you, whenever you travel to India, go and see our kitchens and also visit the schools. But we encourage partners to come and partner with us, because India is such a huge country. And it's not like possible for Akshaya Patra to cater to so many children. Right now we are catering to 2 million children. But there are 120 million children out of school right now. There are so many children in waiting list. But it is not possible for us alone to do it. So we have our blueprint ready. A lot of other non-profits come to us and they learn from us, and then we share our expertise and help them to improve the efficiency of whatever work we are doing. So that there is Samarthanam, another non-profit organization, Adamya Chetana, Havels, so Nandi Foundation, all these people have come and studied our model, and they have started in their own ways in various schools. It requires, because it is a government public-private partnership, the government provides a subsidy in form of grain as well as cash. And because of that, we are able to scale up our program, and it requires only $20 to feed one child for entire school year. So when you say entire school year, it is 232 days. Here it is 180 days, there it is 232 days. So you can come, and government is also helping us to provide land, free land, where we can build the kitchen. So there are two parts to fundraising. One is the capital expenditure, and people come forward to build a kitchen for us in memory of their grandparents, parents, and then the feeding cost is $20 to feed one child. So other all the corporates also come forward to support us with their matching programs and volunteering activities and volunteering hours. So that way we raise funds through few individuals as well as the corporates and the grants. Thank you.
Thank you, Geeta. Tasha?
Great. Yeah. So very interestingly enough, RealOptions, we take the approach in the nonprofit sector to have a vast majority of those that are working with us as paid staff. The reason for that is because we do have our medical clinics. We have to have licensed medical professionals that are available to provide the services that we offer. We do have volunteer medical professionals as well, but as we all know, here in the Bay Area, things are very high-paced and everyone is very career-oriented. So be that as it may, it can be very tricky to pull in help that is specifically able to reach out to the communities that we're involved in. Our volunteers do have a wide array of what they can participate in, and it's our mission really to be able to equip those individuals that have the same passion and heart for the areas that we're serving in to specifically what it is they feel called to be involved with. So that way they can really target their time and utilize the resources to impact the area of the organization that meets their needs. As far as the funding source, of course, since we are a nonprofit, we are all donor sponsorship based with different partners, whether that be individuals, different organizations, religious affiliations. It's a wide range of where we do partner, but everything comes externally. So that way we have the ability to provide the medical services and the education in schools for free, without having these schools needing to pay into that and take away from the budget that they need in the classroom to make sure that our youth are empowered through education. And so these services are all a wonderful way for the community to be empowered and to have the opportunity to get very individualized, specific care with no time restraint, as we've mentioned before, whereas other facilities and organizations are not able to do so given the profit-drivenness of their organizations.
Thank you. Leela?
Yeah, hi. We are a completely volunteer-driven organization. We have about 5 staff, and the rest, everybody is a volunteer. All our coaches are volunteers. They come from the community. They want to give back, and this is one way of them giving back. There are a lot of students who volunteer with us who want to go into med school or they're doing their pre-med. They spend their gap years with us learning, how to talk to participants, the nuances of heart disease and diabetes and the lifestyle. So that's where our volunteers come from. And anybody can volunteer with us if you have the passion for prevention of diseases, for lifestyle, you want to learn anything new about health. All of you are free to just sign up on our website, and we train them. As far as funding is concerned, we are part of the El Camino Health. So 30% of our funding comes from them. They support us with the buildings and other office things. But 70% of the funding we raise through the community. So we have some corporates or participants who run companies who fund us, and then individual contribution is there from all our participants. It's a preventive program. So, the approach is very different when it's prevention versus when it's cure. And I think the challenge comes from raising the funding part of it too.
Thank you. I know you don't run a non-profit, but you have great experience and exposure. So what is, your recommendation advice?
Well, I would say as an advocate that I believe that all the nonprofits need to partner together, pull together. It's just like a small business community. They all pull together so they can make it. And it's the same way with any nonprofits. As they're all talking, I'm thinking, oh, they should know these people, and they should know these people. So there's lots of resources out there to work together to build out what you do. For me, I'm kind of working on a project of building doula houses so people have someplace to go. But that's probably a year down the road. But anyway, I would definitely say that as a nonprofit is that you come together and you create some partnerships and collaborations. And I think that'll make a big difference.
Thank you. So Himanshu, in your case, this is the dearest cause to you. You're personally involved, the co-founder. You look at things a little differently, I suppose. So you've gone through those challenges. Again, those same 2 points, but your perspective, I'm hoping, is a different lesson for all of us.
We are too young to give lessons to everyone. But let me say this. When you are passionate about a cause, when you understand the nuances, you've lived through it, people come together. When we started this nonprofit 3 years ago, in 2019, it was on the motivation of Dr. Mohan Reddy, who's the director of UCSF Benioff Children's Hospital. He's one of the top pediatric cardiac surgeons in the world, one amongst possibly 2 or 3 who can do cases on neonates, like open heart surgeries on neonates. We started with 1. Today we have 22 pediatric cardiac surgeons and pediatric cardiologists who volunteer their time and give free second opinion. And they are from the best in class hospitals, be it Boston Children's, Stanford, UCSF Benioff, Philadelphia Children's. national children's in India from AIMS, which is par with Harvard Medical School, Amrita, etc. We started as like 3 people in the board who were the volunteers. Today we have 60 volunteers, 5 board members. We have been able to give second opinion to 350 families in past 2 years. And every family is a story. So when we talk about this cause, and that's our purpose, to come in such forums and share what we do, because people want to help. They can volunteer with us. They can connect us with philanthropic organizations. They can connect us with corporate giving teams, because our goals are huge. Like 350 is not even a drop in the ocean when you talk about 250,000 children born just in India. Our purpose is, our vision is that we should have 20 such center of excellence who can not only serve the children born in India, but in all of South Asia, Middle East, Africa, even in Europe. I mean, Europe doesn't have that kind of expertise that US has. And we've experienced on our own. So from a fundraising perspective, yes, we are very small today, but we are looking for more and more people and Silicon Valley people like you who are working with large organizations who know that these organizations have multinational presence and want to do something good in the community. You can help us connect with those individuals, those teams, get us 15 minutes, and that's it. That's what we are looking for. Or come and volunteer with us in any capacity that you are. So we, when we started, I am a non-techie guy. I built my website. Today we have a team who manages SEO on Google, because for the parent whose child is born with congenital heart disease, they are just thrown in the ocean. They don't know. Right? And it's very emotional, but they either go to the internet or they go to the temple. And that's where we can help them.
I think these are, like I said, very, very pertinent points, very personal. So in conclusion, we had just started scratching the surface. This is a great topic, relatable to all of us and very dear to our hearts, all these causes. But time is never on our side. We're always playing catch up. We can continue this for another day. But again, thank you. My sincerest thanks to all of you for being here, for sharing your personal causes, personal stories, and relating to all of us in your own unique ways. What you're doing is fabulous. Thank you so much for doing what you do and continue to do. Appreciate that.
Hello, everyone. Thank you so much for everything you've shared. I run a nonprofit myself in a very, very different space, and I'm here today, just to understand from, everyone's experience where I could lead my foundation into, of course, alongside with everyone's support, into a path of success like you all have done. One common question for everyone is, the time, right? That it took you all to go from one board member, for example, sir, you mentioned, to 5, to a volunteer of, 70, 80 people, because that's what leads. I think fundraising is a completely different question. So I would probably just want to understand in general, it takes a lot of patience, and as much as passionate we may be for the cause, to create this impact, what is a general time scale, to kind of grow, grow the impact?
It varies. And I'll tell you from our own experience, we believe we have our working jobs. So we work 8 hours a day like everybody else. But then there are 16 more hours in the day. We try and maximize all of that. Work on Saturdays, Sundays, connect with more and more people, share your cause, share your passion, and they will come along. They believe that you are passionate and you are focused on your mission. People will come and work with you, with or without pay, as I said. Yeah.
Okay, I think we'll be respectful of time and for the other panelists. Again, thank you so much for being here and sharing your. All right. Thank you guys for being a wonderful audience. Appreciate it.